And welcome back to my YouTube channel. In this channel we will discuss about the anatomy. So when we talk about the anatomy, we will discuss first of all introduction and osteology. So in this lecture our discussion topic will be introduction of the anatomy as well as osteology. Let's start the video, but if you are new to us, please subscribe my YouTube channel and press the bell icon. Let's start with the introduction. Head and neck is the uppermost part of the body. Head comprises skull and lodges the brain, covered by the meninges, hypophysis, cerebri, special senses, teeth and blood vessels. When we talk about the brain, then brain is the highest seat of intelligence. As we know, human is most evolved animal so far, so there is maximum nervous tissue. To accommodate the increased volume of the nervous tissue, the cranial cavity had to enlarge. Correspondingly, the lower jaw or mandible had to retract. The eye also had come more anteriorly on each side of the nose. The external nose also got prominent. External ear became vestigial and chin is pushed forward to accommodate the broad tongue. Tongue, the organ for the speech, is securely placed in the oral cavity for the articulation of the words such as speech. In the human, the vocalization center is quite big to articulate various words and speak distinctly. Speech is a special and chief characteristic of the human. Skull comprise a number of the bone and their respective regions. First of all, we will talk about frontal. As the name indicates, lies in front of the skull. Then we will talk about parietal, lies on the top of the skull, formed by chiefly by the parietal bones. It is seen from the top because it is available and lies on the top of the skull. Now we will talk about the occipital, forms the back of skull. Temporal, it is the area above the ear. The sense of hearing and the balance is appreciated and understood in the temporal lobe of the brain, situated on its upper aspect. Now we will talk about the ocular region. It is the region around the large orbital openings containing the precious eyeball muscle to move the eyeball nerves and the blood vessel to supply those muscles. There are accessory structures like the lacrimal apparatus and protective eyelids. Auricular region, the region of the external ear with the external auditory meatus comprise the auricular region. Air waves enter the ear through the meatus, which change into the fluid waves and finally into the nerve impulse to be received in the temporal lobe of the cerebellum. Nasal region, the region of the external nose, its muscle and the associated cavity comprise the nasal region, and sense of smell is perceived from the region. Oral region comprise the upper and lower lips and the angle of the mouth where the lips join each other. Numerous muscles are present here to express the feelings and emotions. These muscles are part of the muscles of facial expression. They show the feelings without the words. Oral cavity, it houses the mobile talking tongue. Tongue is not swallowed through the everything put on the tongue passes downward. It is held in the position by extrinsic muscle arising from the surrounding bone. It says so much and managed to hide inside the oral cavity to be protected by 32 teeth in adult. Now we will talk about parotid gland, lies on the side of the face. It contains the biggest serious parotid salivary gland, which lies around the external auditory meatus. Head is followed by a tubular neck which continues downward with chest or thorax. Each half of the neck comprises two triangles between anterior median line and posterior median line. Posterior triangle lies between the sternocleidomastoid, the neck and the chin turning muscles, trapezius, shrugging muscle and middle 1/3 of the clavicle. It contains proximal part of the important brachial plexus, subclavian vessel with its branches and tributaries. Its apex is above, base is below. Anterior triangle lies between the anterior median line and anterior border of the sternocleidomastoid muscle. Its apex is in lower part of the neck close to the sternum and base above. It contains the common carotid artery and its numerous branches. Isthmus of the thyroid gland lies in the lower part of the triangle. Now we will talk about Bones of head and neck include the skull, cranium, mandible, 7 cervical vertebra, hyoid, 6 ossicle of the ears. Skull cap formed by the frontal, parietal, squamous, temporal, and occipital bones developed by the intramembranous ossifications, being a quicker one-stage process. Base of skull is contrast ossified by intracartilaginous ossification with a two-stage process. Skull lodges the brain, teeth, and also special senses like cochlear, vestibular apparatus, retina, olfactory, mucous membrane, and taste buds. The weight of the brain is not felt as it floating in the cerebrospinal fluid. Our personality, power of speech, attention, concentration, judgment, and intellectual are because of the brain that we possess and it is proper use. So guys, if you like the video, please subscribe my YouTube channel and keep watching, keep supporting. Thank you.